Thank you for listening to the talk today. So today's talk is about the top 5 risks and complications associated with ankle fusion. Now, this is not designed to scare anybody, it's just so people can make an informed choice regarding the surgery. I believe that ankle fusion surgery is a very good surgery, but as with all surgery, there are risks and benefits and complications. The talk today is based on some paper with some specific figures, but these can vary from person to person, so please discuss with your individual surgeon. Now, the figures today come from this paper, which is consent and foot and ankle surgery, and this is where most of the information comes from, so please check out that article, and certainly they can take the credit for most of the information. Now, ankle fusions are usually performed for arthritis of the ankle, and then we've got another talk on that if you really want to know what osteoarthritis is. We're going to label some of the bones of the ankle for you today. So the one I'm labeling here is the tibia, or otherwise known as the shin bone. The bone next to it is called the fibula. It takes about 1/8 of your weight. And then we've got some other bones further down. So we've got your heel bone, which is otherwise known as the calcaneus, and it looks like a circle when you look at it from the front. And then this bone here is called the talus. Now, the bones that are fused in the ankle are the tibia and the talus. So we're going to draw a picture here for you of what this picture will look like once we fuse the ankle. And so you can see here on the diagram that there is no longer a gap there between the tibia and the talus, and that's what a fusion looks like. Bone crosses the joint, and so you no longer have a functioning joint at that level, but it is very good for pain relief. Now, the first risk associated with this surgery is something called non-union, which basically means that unfortunately the two bones don't glue themselves to one another. That's the tibia and the talus, meaning that the fusion essentially doesn't take. Now, this here is an x-ray showing ankle osteoarthritis. The reason I say that is because the joint space there, indicated by the arrow, is far narrowed. Right, now in a fusion, this middle photo is a successful fusion. We've got some screws that are holding things in place. The bone has crossed the gap between those two bones. And then the one on the right here is unfortunately a failed fusion, which is known as non-union. And there's a gap there, but it's all sort of splintery. It looks a bit odd, and this means that unfortunately bone has not crossed the gap. Now, patients that unfortunately have a non-union, the risk of this happening is somewhere between 9% and 13.7%, and these patients will often have pain after surgery. They'll have hardware breakage in some cases, and often they need the surgery to be redone, and this is sort of 8, 9 months, 12 months down the line. Now, risk number 2 is infection. Infection is associated with all surgeries. Now, infection can be either superficial, meaning that it hasn't really got down to the fusion site itself, but it might affect the wound on top, or it can be deep, meaning that it's gone down to where the bone is, where the fusion site is, where the hardware is, and that's much more serious. So superficial infections can often be treated with antibiotics, sometimes through a drip or even via tablets, whereas deep infections are actually much more complicated and require a lot more treatment. Now, deep infections are a real challenge. So deep infections will often require more surgery, unfortunately, for the people that unfortunately suffer this complication. Usually you'll need some sort of debridement, meaning removal of the infected tissue, and that's usually done under general anaesthetic. More often than not, you'll need removal of the hardware. That means taking out the screws and plates, and sometimes you'll need something else that holds everything in place in the meantime, and usually you'll need a longer period of antibiotics, often through a drip followed by tablet antibiotics. And then when the infection is cleared, you may need the revision surgery, so as in the fusion may need to be redone. So that's an awfully long recovery if you're unlucky enough to have this complication, which the risk is around about 6% or so of suffering. So that will vary, and I'm sure a lot of surgeons will disagree with that. Certainly literature, that's what it is. Number 3 risk is revision. That means actually having to redo the surgery. So as I mentioned before, this is the x-ray that we showed you before that shows the non-union, and then the next one, that's when this actual person's surgery was redone. They had an extra screw there. The bone has now crossed the fusion site, so we had an extra screw there to the 2 that were there originally, and that person had a good result in the end, but they needed a redo. So the non-union the reason for a redo is often that non-union that we talked about before, a malunion meaning the bone fuses in the wrong position, or it can be for infection. So redo, the risk of you needing a redo with after having an initial ankle fusion is around about 10.3%, so about 1 in 10. So it's not that uncommon, and certainly does happen. Now, risk number 4 is pain from the hardware, meaning pain from the metalwork that we put in for the fusion. As we see in the picture here, this is the ankle fusion. It's fixed with some screws there. Now that top screw there you can see is sitting out of the bone. That can cause some irritation. If you had a plate on that where that red line is there, you can certainly suffer some irritation from that as well. So the risk of you having an irritation from the hardware is about 9%, but that doesn't mean you necessarily get the hardware out. That just means about 9% of patients can feel the hardware or get some level of irritation from it. Now, risk number 5 is arthritis of the adjacent joints. That means that other joints that are involved in the foot of the ankle can develop arthritis because the ankle is much stiffer. So this is your ankle fusion, looking at it from the side, and we can see here in this next arrow that was a joint called the subtalar joint, which sits below the ankle. And then we're going to label another joint here called the talonavicular joint, which is a bit further down from the ankle. And either of those two joints can develop arthritis on X-ray because the ankle is quite stiff. That doesn't mean you're going to get pain from that though. All we're saying that is if we did an X-ray sometime down the track from ankle fusion, those joints may have some arthritis in them, but they may not cause any problems. And the risk of that is around about a bit over 6, around about 6.5%. Now, other risks associated with this surgery that are not on the top 5, but certainly are risks associated with ankle fusion, are anaesthetic risk, which is the case for all surgery, something called deep vein thrombosis, which is a risk of a clot, nerve injury, which is pretty unlikely in an ankle fusion, and then something called chronic regional pain syndrome, where your nerves in the area get very sensitive. But the take-home message from this talk is basically you really should discuss with your surgeon what the risks are about ankle fusion surgery before you have it, and outline what the risks are and the percentages so you can make an informed choice. As I said before, ankle fusion surgery is good surgery. You just need to know what you're getting into. So, as always, visit our website www.hunterfootandankle.com.au for more information. Thanks for listening today. Bye.